Hi, this is Dr. Motwani from Cornea Revolution. One of the toughest things that we see is patients that have had corneal scars. The scars are from infection, like contact lens related infection or trauma. They got injured in the eye and got a scar. Sometimes it's herpetic or viral infection, or sometimes it's fungal infection. Infection and trauma are the two leading reasons why we see significant corneal scars. And patients have essentially told, when the scar is in their vision and blocking their vision, they're essentially told you have to get a cornea transplant. And, or you can try scleral lenses, okay? And the thing is, scleral lenses can overcome the irregularity of the cornea because, as you can imagine, trauma and infection don't scar or damage the cornea evenly. So there's going to be irregularity and blocking of light from the whiteness of the scar. So if you actually try, for example, a scleral lens, you get rid of the irregularity, but it doesn't get rid of the white blocking opaque scar. And so then they can recommend, doctors often recommend a cornea transplant. Cut out your cornea, get a donor cornea from a cadaver, we sew it in. The problem is, cornea transplants, 40% of them fail within 10 years. That means you have to keep doing it again and again. Second, your cornea transplant is also quite irregular because you're taking a cornea from someone else without being able to match the shape, putting it on this person, and you're hand sewing it into place. So it leads to an irregular cornea. So you get rid of the blockage, but you have an irregular cornea. A scleral lens gets rid of the irregularity, but you still have the blockage. Most people with corneal scars do not have full thickness corneal scars. Pretty much every patient that's found its way here that's been told that they have a full thickness corneal scar does not. There are tools to look at the scars, to do cross sections with a shine flood camera or an OCT anterior device. We can look at these things and get an idea. Virtually no one has a full thickness scar, even though they're told that, because if they did, they would have actually ruptured their cornea, okay? And they would have had a medical emergency with a ruptured globe, and they would know about that, okay? A lot of times you can remove the actual white opaque tissue, okay? That you can do that with laser. That's called PTK. PTK will remove the amount of a certain amount of tissue to get down to clear cornea, get below the scar. And believe it or not, most corneas actually have quite a lot of tissue that you can actually PTK. In other words, the amount of tissue they have, even after you lose some from an infection or trauma, there's quite a lot. So you can actually very successfully get below the scar. Then it leaves the irregularity that's residual from the trauma or from the infection. That can be fixed with topography guided ablation, or that can be also fixed with a scleral lens. So you can successfully remove with a laser, you can remove scar and then go to a scleral lens, or have someone who does topography guided ablation as well, remove the laser and then remove the scar with a laser and then do topography guided ablation, or if it's possible, combine both things into one procedure, okay? So these are very viable. So I urge people who've had these very unfortunate things happen to look into these kinds of solutions rather than just go straight to a cornea transplant.